Healthcare and high prescription drug costs, important issues this election season. The midterms are just a couple of weeks away, and candidates are campaigning hard right now. Fox 43's Harry Lee discusses policies and not politics with the candidates running in Pennsylvania and their solutions to bring down drug costs.
I do that.
Linda Pentz of Spring Grove has had diabetes since 1987.
And it counts down what it is.
She has to take her blood sugar 5 to 6 times a day.
Well, it's 217, but that's because I ate breakfast and my one pill that I take puts my sugar up.
Pentz says she's learned to live with taking insulin. What she still struggles with is paying for it.
And I'm on 2 different insulins, so that's $90. $75 for these, so that's another $45, $50. I'm also on heart medicine, which is expensive.
Pence pays much less than retail price for her medications because she's enrolled in PACE, Pennsylvania's prescription assistance program for seniors.
Bye.
She thinks the government should do more to lower prices for everyone.
The younger people need help too, for the prices, especially if they're on insulin or their children are on insulin. It's a big burden for everybody.
High medication costs have emerged as a central theme of the midterm elections. Americans pay nearly 3 times as much as people in other countries for the same drugs. The reason why? Drug companies are allowed to set their own prices with virtually no limits. In September, Congress passed the Inflation Reduction Act, which caps insulin costs at $35 a month and allows Medicare to negotiate its most expensive drugs. But those won't come into effect for a while and only help seniors and low-income people. Here are what state and federal level candidates are saying they'll do to cut costs for seniors and everyone else. The Pennsylvania governor can't change drug prices, but he can influence state programs. In a one-on-one interview with Fox 43, Democratic gubernatorial candidate Josh Shapiro said he would expand services for low-income seniors.
My plan would be to attack PACE and PACEnet, which is so many Pennsylvania seniors rely on, and to use that to reduce the cost.
Shapiro would also try to negotiate better prices for state employee health plans.
We need the Commonwealth of Pennsylvania to do a better job of negotiating drug prices. We're giving up our leverage when it comes to negotiating the prescription drug price cost, and we're going to do a better job of that.
Republican opponent Doug Mastriano didn't respond to a request for comment for this story, but in 2021, he introduced legislation to cap insulin prices at $30 a month per patient, after the cost of the 4 most popular types of insulin tripled in the last decade.
Why are the costs going up for an old medication that's been around for a century, and when other countries like in Europe and Australia and elsewhere, people aren't paying out of pocket as much?
The Senate bill was never brought to a vote. The U.S. Senator from Pennsylvania can vote on legislation to directly limit drug prices. Republican Senate candidate Dr. Mahmet Oz says he doesn't support the Inflation Reduction Act. We asked if he supported the specific provisions to negotiate Medicare drug prices and if he would support expanding negotiations for those with private insurance.
I'd be interested in looking into this in more detail. You're asking a fairly complicated question, but the problems with the Inflation Reduction Act were not the parts of it that dealt with reducing health care costs for Americans.
Pharmaceutical companies say they have to overcharge to continue research and development of new drugs. Oz says he has a solution.
So, for example, if we at a federal government level said we're going to create these groups of medical centers, they're going to do clinical trials a lot more quickly and very rapidly figure out if these drugs work or not. Well, that could shave off the usual rates of success. Right now, it's 1 in 20 medications succeeds, but we're all paying for the other 19, even though we never get benefit from them because someone's got to pay for the experiments and the and the research. So we can make that 1 in 10 maybe. And that would dramatically drop the cost of medications, and we would expect and insist that that money comes back to the American people.
Democratic Senate candidate John Fetterman did not make himself available for a one-on-one interview, but he wrote in a statement, "I will push to bring down the cost of prescription drugs by continuing to take on the pharmaceutical companies that jack up prices. We must allow for the importation of lower-priced prescription drugs from other countries and limit drug costs for all Americans." Fox 43 has all the info you need to make an informed decision this election. Find more on our website. Harry Lee, Fox 43 News.